Okay, and we're back for Anatomy of the Skull, Part 2. And so where we left off was the lateral view, and we were looking at stuff like the temporal bone, the squamous suture, mastoid process, etc. So now we're just going to continue our little tour, and I'm going to turn it all the way around to the back. There we go. And unfortunately, this doesn't have a calvarium on it. Calvarium is the part that's missing, obviously, the top domed part. So what that means is that we can only see part of the lambdoidal suture. Really, it should be going up kind of like this. So I'll just kind of draw some other stuff in. So going up to the top, roughly like so, would be the sagittal suture. And that would separate the parietal bones from each other. So I'm going to use a different color for the bone. So this is parietal bone, and so is this. So since I'm drawing in stuff that's not there, that's actually also a way you can practice using these 3D models is you can go to the visibility tab, or you can add and subtract pieces, which I'm actually going to do in a little bit, and then you can try and draw what's missing. So any way you can sort of shake up your study habits and find different ways to practice or learn things and add variety, that will help it feel less boring, because I know that it gets dry and boring sometimes. Okie dokie, so that's the posterior view. Now let's go look underneath. Boop. So we've got the occipital bone, which I do have its own video about, so I'm not going to recapitulate every single feature of it, but I will point it out. And actually, let's zoom in a little bit. I think that's appropriate here. There we go. Okay. So the little bump at the back, which is not fantastically visible here, but you can still see it, is the external occipital protuberance. And this big hole is called the foramen magnum, which means big hole. And then on either side, these sort of almond-shaped facets are the occipital condyles. So those are some features that you can see in an articulated occipital bone, as opposed to the view I previously showed you, which was in disarticulated one. Okay, so one thing I want to do is go over here to visibility. And let's see if we can remove some things. Crop skull, temporal bones. I really would like to subtract only the mandible, but it looks like I don't have a choice. Yeah, bummer. Oh well, no matter. So we'll make it work. So the reason I wanted to subtract only the mandible is because I wanted a better view of the hard palate, but I think this will suffice. So I'm going to erase this stuff, and we're just going to kind of selectively zoom in on some particular parts. So I'm actually going to start with the underside. Oh, come on. Carefully. There we go. I'm going to start with the underside of the temporal bone. So just for some additional context, this is the underside or inferior view of the mastoid process, and same deal, inferior view of the styloid process. And then you can also see the condylar process of the mandible articulating with the temporal bone right there. Forming your temporomandibular joint. And as you can see, in addition to the foramen magnum here, we have a bunch of holes. So for my class, some of these holes you have to know, other ones you don't. So it's nice that there's a reduction in the list of holes because there are a lot and it can be a lot for students to take in. However, a non-complete list of holes means that sometimes you run the risk of mistaking one hole for another hole, and that is its own problem. So that particular issue comes into play with the carotid canal. So what I'm going to show you is it, and then I'll show you the few things around it that are not it. Not because they're on the list of stuff to learn for my class specifically right now, but just so that you're not mistaking one hole for another hole. Okay. So I'm just going to tilt this a little bit until I get the view that I want, or not. Hold on. Maybe it'll be easier if I make this little head smaller. Oh no, that's as much as I can do. Okay, I see how it is. So the carotid canal is part of the temporal bone. It does go through there. The reason I was trying to tip this back further is because I wanted you to be able to see into the jugular foramen, which is right nearby and sometimes mistaken for it. So I'm going to outline the carotid canals in red since they contain an artery carrying oxygen-rich blood. Boop, boop. And then I'm going to outline the opening to the jugular foramen in blue because that is a vein containing oxygen-poor blood. So you can see they're pretty close to each other. So that's where the confusion comes from. But if you look, the carotid canal is nice and round. Whereas the jugular foramen is more bean-shaped. Or oval, but really kind of bean-shaped. So the carotid canal is anterior and it's also much rounder than the nearby but not carotid jugular foramen. So that's how you tell the difference. The only other thing that you might risk confusing for the carotid canal would be this hole right here, which is the foramen lacerum. But that's anterior, and if you can look carefully, what you'll notice is that the occipital bone kind of comes to a point that's almost like a handle right here, and the foramen lacerum is on either side of that little handle piece. So it's not part of the temporal bone, it's actually the confluence of a couple bones that make a space, whereas the carotid canal is firmly within the temporal bone. So that's how you tell those apart. Okay, so you can also see a couple of the sphenoid foramina from the bottom here, specifically the foramen ovale. I'm running out of room, but I'll just make it work. The foramen spinosum. So those are in the sphenoid bone. So that's just a grand tour of all the little tiny holes. They're all next to each other. The ones that I'm going to circle in white are the ones that are fair game for my class. And the ones that are uncircled are holes that are nearby, and I'm only telling you about them because I don't want you to mistake them for the holes that you do have to know. So that's the deal. Oh, and let's also label the foramen magnum, which is also for my class to know. It's easy though. It's a big hole, and that's what its name means. Okay, so that is the holes that you need to know from the inferior aspect. So looking up at the bottom of the skull from down below. There's a couple other things I want to show you down here before I flip this, and we're going to look down into the skull and where the interior of the cranium from the top. So let's move this down here. So what I wanted to do, and then this is decent, it's fine. I wanted to show you some detail of the hard palate without the mandible in the way, but I don't really have the option to remove only the mandible, it seems, so we're just going to make it work. So the hard palate is what I'm going to highlight in this fun blue color that I like. Let's make that dot bigger. So the hard palate is just the part of the roof of your mouth that is bony and rigid. And then the soft palate hangs off of the back of that, but obviously since it's not bone, it's not pictured here. So everything in blue is the hard palate. Now, the anterior portion of the hard palate is made of what is called the palatine process of the maxilla. Basically, it's just the part of the maxilla that forms part of the roof of your mouth. So I'll put in parentheses. And then behind that, you can actually see the little seam here. And then there's also a bilateral seam, or excuse me, a mid-sagittal seam. So everything behind this little seam is not the maxilla. It is instead the bottom view of the palatine bone. Palatine meaning of the palate. And, oops, I want that to be skinnier. So similar to the maxilla where the palatine process is called that because it articulates at the palatine bone, this part of the palatine bone is called the maxillary process. So the hard palate consists of anteriorly two halves of the maxilla, so the palatine processes of the maxilla left and right, and at the posterior side, the hard palate is made of two palatine bones which meet each other in the middle. And the portion that's making up the roof of your mouth, because there is other spots of the palatine bone that go back up into the skull, but this particular portion is the maxillary process. So again, in white, I'm going to circle and circle just so that we can see the difference between the two. Okie doke. So now we're going to flip this. And also I'm going to make it a little bit smaller just so I have more power to rotate to my preference. All right, that's good. So inside of the cranial cavity, we've got a variety of things. Some of them are things that are the holes that you can both see from above and below. So I'm going to label some stuff and then I'll rotate this a little bit because there are some things that you can't quite see in this particular view. So here's what the ethmoid bone looks like from above. And we've got, actually, let me label all the bones in blue and then I'll do the features in a different color. I think that makes more sense. So that's the frontal bone, making up the roof of the orbit. We have here the sphenoid bone. Temporal bone is here and also here. And then we have the occipital bone here at the back. So that's what you can see from this view. Now, for features, which I'm going to start labeling in green, we've got crista galli of the ethmoid bone. All these little bitty holes are the olfactory foramina. In sphenoid bone, we've got, how do I want to do this? Let's see. So this hole here and this hole here are the optic canals, where the optic nerve passes through. From this particular view, you cannot see the superior orbital fissure. I will need to rotate for that. You can kind of see the foramen rotundum. And you can definitely see the foramen ovale and the foramen spinosum. And then right over where I've inconveniently written sphenoid bone is a little dent, which is called the hypophyseal fossa. Which is where your pituitary gland lives. And the bony structure that includes the fossa and this part is the thing that's called the sella turcica, or Turkish saddle. There's also this bit, which is the lesser wing of the sphenoid, and then the piece that contains the foramen ovale and the foramen spinosum, as well as the rotundum, and makes up the bottom border of the superior orbital fissure. That big piece is the greater wing of the sphenoid bone. So that is what you can see from the inside as far as what you need to know. You can also see some other stuff like the foramen lacerum through this side, and you can also see the internal acoustic meatus, but those things are not on your list, so I'm not going to point them out. So let's just do a quick tour around and see if there's anything I missed. And if there's not, and I don't think there is, I will just end this video and pop on over to the vertebra models and do videos for those. All right, so let's just have a final tour. Calvarium removed. We can see the cranial cavity, the floor of it. I hit all the points I wanted to hit here. Oh, there's one or two more things. I'm glad I checked. So we talked about the massoid process and the styloid process of the temporal bone. We did not talk about this, which is the zygomatic process. Of the temporal bone, nor the fact that the reason it's called that is because it articulates with this weirdo little three-sided bone here called the zygomatic bone. So it's called the zygomatic process of the temporal bone because it reaches forward and articulates with the zygomatic bone, which makes up your cheekbone. So that's all I'm going to do for this one. I have a video of just the mandible, so I'm going to leave the mandible stuff for that video, not do it here. And the next video will be about the different types of vertebrae and how you can tell which one you're looking at. So thank you for your attention, and I will see you in the next video.